Hello, this is a note on Ganga Hospital, Coimbatore, and its social outreach activities with special reference to the project Hope After Fire. Thank you for sparing your time to listen to this recording. If you take up the journey of the Ganga Hospital, I think we should say that we started in 1978. It was a small hospital of 17 beds started by my father. He was an anesthesiologist with two operating rooms. And we are ever grateful to our parents because from the very beginning they taught us the value of the values. And in 1991, when we finished our education, we completed our formal education. I was trained in India, and then later I left to UK and then USA. And my brother also spent 3 years in the UK. We came back in 1991, and at that time we expanded the hospital to 35 beds with four operating rooms, and it was made as a specialty center catering to the only to the two specialties of plastic and reconstructive surgery and orthopedics, and we mainly concentrated on trauma. In 6 years' time, we rapidly grew from 35 to 135 beds with six operating rooms, and we soon really ran out of space, and we moved over to another area which is about called half a mile away, and it led to 420 beds with 17 operating rooms, and presently we are 650 beds with 36 operating rooms, and still we are mainly concentrating on the two specialties of plastic and reconstructive surgery and orthopedics. The journey of the Ganga Hospital is because the growth is primarily because due to our work on trauma, and we concentrate on four A's. Number one is availability, the next is ability, and third is ability, and the fourth is affordability. And we do about 34,225 surgeries. That is roughly about 100 surgeries a day on any working day. And we see about 2.5 lakhs of outpatients. How did we grow? I think this is because of the disruptive innovations in the management of trauma. We introduced reconstructive microsurgery in the region, and we got good outcomes, unbeatable outcomes when compared to other hospitals. But the scenario in 1991 was very different, and we soon understood that nobody gets injured with money in the pocket. Then, since we are specialized in reattaching amputated hands, scalp, and body parts, then how do you do this specialty? How do you practice this specialty? How can you reattach the amputated hands, which need to be done immediately when the people have no money? At the time, we did not have any credit cards and no mobile phones, no pages. So what we did was we started doing them all without getting any payment. And thus started the system of nobody pays on arrival in trauma. So even today, anybody who comes with a major injury, nobody pays at Ganga Hospital. And this also started a different system, what's called as variable pricing, so that our services are available to all. If a patient is able to afford only 60,000 when the surgery should cost about a lakh of rupees, we still will do it. But then we survived because of scaling, and this was considered as a great business study. And IIM Bangalore took it as a case report, and later on it was published as, in Harvard Management Case Studies. And what more than that, what we are proud about is we became a destination for teaching and training. And to date, to the Department of Plastic and Reconstructive Surgery, we have had 3,600 surgeons as visitors, and they have come from 91 countries. And this is a record for any unit in the country. And our trainees are from 167 cities of India. So we crafted this vision statement when we started. When we started in 1991, we started this. We wrote this vision statement, which is said we have to become a center which will be the pride of our country. And in our mission statement, we said we'll provide quality treatment at affordable cost, so that the expertise will be available to every citizen of our country. And religiously, we have maintained maintained the vision and mission statement. And to give briefly a note on the project Hope After Fire, would ask me what is this project, it's a project for reconstructive, they're doing reconstructive surgery for burn deformities that is entirely free. What's the reason and what's the scope of these projects? What is the necessity for such type of projects? If you take all developing countries, you will find there will be a healthcare need will be so much, but the availability will be suboptimal, and there will be a gap between need and availability. But then, what is more tragic is that there will be a gap between availability and utilization. If you want to cover up the gap between need and availability, that means it has to be done by the government. I think it's very difficult to do. That involves capacity building, getting more doctors, building more hospitals, and transport of patients from one place to other. So that's in a bigger scale we have to do it. But then there's a gap between availability and utilization. I think this gap, doctors can fill it. I think doctors and like-minded people can do it. What is really required is getting a matching between the skill set of people and the people who could fund. The goals of this talk is the second one is to talk about the projects that we do. I think I'll take one project, but I'll briefly talk about the other project. The other project is called as Project Shakti, where we're empowering women. This is detecting breast cancer early by doing mammograms. And everybody who gets detected in those camps, the treatment is also entirely free. And we're very proud to say that we have done 10,000 mammograms in the last 3 years. And the other one is Walk for Life is a project for the diabetic foot to prevent amputations. And we are part of Smile Train, where all the cleft lips and palates are done free in our hospital. So what is this project Hope After Fire? And I think it's a project to provide totally free. I think the patient doesn't pay anything at all. Totally free reconstructive surgery to people affected by post-burn deformities. And why is this post-burn deformities very different? Is because the management of it is skill intensive, it's labor intensive, and it's resource intensive. I just give an example. This is one of the patients we did early on. The patient is a young lady who is 5 months now. She had to be treated. She came to us with both the legs plastered and stuck to the knee. And seeing this picture, it might look, oh, it's so simple, it's just like that, it's there. But then you have to think, but this lady cannot walk. And both, thighs are all plastered together. That imagine how will she go to the restroom, how will she go to the toilet, and monthly periods. So if you really think there are so many problems that a person can have, and this same patient after 5 months of treatment, I think this is the result that we obtained. So the same patient who has just never gone to the bathroom for about 2 years, I think we are able to do this. But then, between the clicks between the two slides, I think there remains a greater story. You will find that this lady, after 2 months of treatment, now she reached this stage. See, you just can't straighten them straight because the vessels get shortened, the muscles get shortened, they have to be stretched and then grafted slowly. And two of the physiotherapists do about 20 minutes of work every day in the morning and afternoon and evening. And even for us, it may be tiring to look even for 20 minutes, but then they do it, it's a great job. And after another 3 weeks, I think she reaches this level where she's able to manage a little bit more. And more 3 weeks, and she's instead of 2%, she has got only 1%. And gradually she's getting there without any person, and finally she gets there. And the cost of care is 8 lakhs, but then it is available totally free to the patient. Let's go to another story. So here you see a patient whose original face was like this, but then he got badly burnt. He was from hills in Kuno. One of the cold days when he was trying to make coffee, I think some accident happened and he got burnt. His clothes caught fire. And when a person reaches this stage, I think that's the stage of no return. They cannot go in a public transport. They very much may not afford to go to a big center. If they go to a big center, that means they have to go in a car or a taxi, which many other people may not take him. And then once he reaches there, and if they give him a date and say, come on another day, that means, if there is refused admission for 3 or 4 times, then he starts feeling, oh my God, now we are spending so much for our vehicle, I think better we not go. And if they're living in a rented house, The owners, they request them to vacate because children can't see. The same patient had a hand which is very bad, and technically speaking, treating this hand is more difficult than treating this face. And the same patient now, after all the surgeries, works as a security person, security guard in Kuno. And the cost of care is over 10 lakhs, and we treat it totally free to the patient. The journey so far is we have done over 1,700 surgeries and 91 patients, and the total value of the project is more than 13.74 crores. And it's done in conjunction with the Rotary Club of Coimbatore Metropolis. And they pay for the consumables, the subsidized hospital stay, and for 50% of the anesthetic fees, but the surgeon does it free. So the free component of what we have done is about 5.5 crores. And there's the spread of for the patients that we can expand even more. We can scale up only subject to the availability of funds. So what is unique about this project? It's because we do procedures for people who fall outside the radar of all healthcare system due to the complexity of the solution. For example, if you take this lady, she's a migrant labor from Mauritius. She was living in Chennai. The accident happened in Chennai, and she's been burnt, and her face and the hands have been involved. And if you look at her hands, these hands cannot do anything. That means, she's totally dependent on for all activities, and it's a soul-destroying situation. We have treated her face and hands, and then to a certain extent, and then we have reconstructed one of the hand to a functional hand. And what happened is this is 5 years, 5 surgeries done over 3 years, and totally free to the patient, and the second is under reconstruction now. So we address the issue from start to finish. We complete the loop. If you really see, most healthcare projects where CSR funds are used, they address one aspect of the issue, that is the issue that is convenient or comfortable to do, but not fully when it is needed. So here we need to run a marathon and not a 100-meter sprint. For example, if you see this young lady, this is the right hand. See, she's trying to hold things which she can't really. And in the left hand, she's had a number of reconstructive surgeries, but this the hand has gone from one little place to the other, but then still it's totally not functional. It has not reached the functional stage. And what we have done is after reconstruction surgery, you find that both her hands have now started usable. She has got married, we have given her life, and we have given her affiliation. I think she has become a wage earning person to the family. And the impact is higher when the correct reconstructive surgery is done for children. See, here you see a child who just put a hand into a boiling water, and after treatment, it resulted this, and with the right hand, schooling stops. And you will find that after reconstruction surgery, the patient is able to use the hand. And literally, we can say that we are given the literacy to the child. She's putting the first letter, she's putting it. And the mother really took this picture and sent to us, I think, thank you for giving education to my child. And since the reputed organization is involved, a long-term continuity of care is ensured. I always believe that whenever you do a healthcare project, it needs to be with an institution which is bound to take care of them over a period of years. For example, this child we saw when the child was 1 year old in 2013, and it underwent a series of reconstructive surgery procedures. And when the child was 2 years, the child is like this, the hand is functional. But then the child came to us now when the child was 11 years old in 2023. And she came because there was a tightness. This is the effect of growth. So at this time when they come, I think they got an address to come back to. So they reconstructed that. And this child, later on in 15 years, I think she's able to do everything. So if we are working with us, I think they got an institution on which they could trust that they should come back to for future reconstructions. If the address is not there, we will not fully utilize the work done initially, and sometimes the whole effort may be wasted. And we need to lumber on. I think that's very important. Impact comes to run the last mile. You see the hand, the elbows are involved, the wrist is involved, the fingers are involved. And actually, she's a young girl. She was just in the +2, and she went back to studies. I think the girl was the girl who has got a star on the head. You will find that we have made her hand write like this, and she has got a handwriting, which is much, much better than many of the doctors of our hospital. So we are not making the hand a normal hand. But then we are making the hand to go do normal work. I think that's what is the projects. We also build trust about the project in the community. So it is the lady who had it, and the people did some camps stating that they will be operated at Ganga Hospital, but then this lady didn't come to the camp. And she came a few days later straight to the hospital, the whole face covered like a mask. And we asked her why you didn't come to the camp so that you could have even had it earlier. He said, "So we are tired and fed up of camps. I think they all tell us they'll do, but they'll not do. And then for two reasons we came now. I think we understood that is really will be done one. And they'll do it at any time you want. That's the number two. And it is totally really free. So that's what we have done. I think from the stage where she is, I think extremely difficult to even eat. I think we have done this. So she's been ever grateful. And we did not formalities, we didn't know worry about whether they are poor or rich. I think if we're such badly injured people, I think we just treated them. We did not wait for about geography. I think it's a lady from Uttar Pradesh after an acid burns. She came like this, and we made her better. And after that, no, she now works as a chef, and she's now confident to go out. I think amongst the people. We help people integrate into society like no other. For example, if you see this gentleman, she had an injury, and in fact, no, it's close to begging. I think one of the Rotarians saw him when he was begging in front of a Tasma shop and brought him over here. And then we got him out like this. And from that stage, I think we got him on to this stage. And once this was a candid shot that was taken by one of our social workers because after he went out to a hospital on one of the follow-up visits, he himself took a selfie of himself to see how he is. I think this is a great moment of joy for all of us. So going back to the first thing where we started, I think in India, the problem of reach in India is there's a gap between need and availability, and there's a gap between availability and utilization. And when we want to discuss the gap between availability and utilization, this is the important slide. For example, when a hospital does some complex major surgeries, there will be a cost of care to the patient could be so much. But then there's a minimum that is needed to sustain the hospital, and below which the hospitals can't do the job. Okay, that's there. But then very many times the patients can't afford even that minimum, which is with even if we say no profit time, if you want to do, then we can't sustain. There will be some price affordable for patients, but there is a big gap. And it is this gap which could be filled up by CSR. CSR helps to bridge the gap between availability and utilization. And more importantly, the gap between the minimum needed to sustain the service, the amount affordable by the patient. Our department trust is recognized, we receive CSR funds, and we have been claimed as one of the best institutions for utilization of the CSR funds properly. And we are known to strictly adhere to compliance standards in terms of timing and reporting. And together, I'm sure now we can make a difference in the lives of people. And the difference that we make is very visible. I think it's very visible, and the beneficiaries are extremely grateful for your help. And we are believers of Swami Vivekananda's word, that is they only who live for others. And we welcome you to Ganga Hospital, and we welcome you to participate in our efforts to making a change in the lives of people. Thank you so much.